Thank you for your interest in the Alaska SHARP program. My name is Natalie, and I work as the data analyst for the program. As SHARP continues to grow its presence in Alaska, we have identified a need for some supplemental materials to help applicants and employers navigate the SHARP application process. Many people know that they want to apply to SHARP, but may not be sure whether to choose SHARP 1 or SHARP 3 and what the requirements of each program entails. The SHARP program is comprised of 3 critical participants to make the program work. That includes the employee, the SHARP program office, and most importantly, the employer. When you consider applying for SHARP, you need to first know some basic information of your employer or your future employer for those who are considering the big move up to the beautiful state of Alaska. You need to know if your healthcare facility is a health professionals shortage area, or HPSA. You can only participate in SHARP 1 if you work at a HPSA facility. If not, you can only apply to SHARP 3. You can use the link provided to check to see if your facility is in fact a HPSA facility. You also need to know if your facility is nonprofit or a government facility, such as the Department of Corrections. SHARP 1 is only available to nonprofit and government organizations. SHARP 3 is open to all types of organizations, be they nonprofit, government, or for-profit. Next, you need to know the work you do, or the work you will be doing. All providers must deliver primary care. Primary care means the delivery of professional, comprehensive health services that include health education and disease prevention, initial assessment of health problems, treatment of acute and chronic health problems, and the overall management of an individual's or family's healthcare services. It entails first contact care of persons with undifferentiated illnesses, comprehensive care that is not disease or organ specific, care that is longitudinal in nature, and care that includes the coordination of other health services. Primary care dental services and behavioral health services are included. Providers must be in an outpatient setting unless they work at a tribal facility. Then they can provide inpatient care and participate in SHARP 1. All others must apply to SHARP 3. Continuing on with knowing the work you do, consider how much of your work week is devoted to direct patient care. An estimation here is fine. To participate in SHARP 1, providers must allocate at least 80% of their workload to direct patient care. If your direct patient care percentage is less, then you may apply to SHARP 3. You'll also need to know which tier your occupation falls beneath. Tier 1 is primarily for advanced degrees such as doctors, dentists, and pharmacists. Tier 2 providers must be licensed and non-specialists such as RNs, nurse practitioners, dental hygienists, and licensed professional counselors. Tier 3 is only available in SHARP 3 and generally covers almost all other healthcare professionals, including behavioral health technicians, physical therapists, and administrative workers like receptionists, program managers, etc. One of the most often overlooked aspects to the triangle of participants is the employer. Many applicants forget to have a conversation with their employer before applying. This is so important because after your application goes through our admissions committee, it is sent to the employer for their final decision. The reason for this is because the employer will be entering into a contract along with the State of Alaska SHARP program and the employee. The employer is required to provide employer match funds for all SHARP contracts. When you apply to SHARP 1 during the on-cycle admissions, the employer will be paying 50% of that contract's support for service for their first 3 applicants that they accept. After that, they will be responsible for 80% of each additional contract that is accepted during the on-cycle admissions. During the off-cycle time, the employers will be responsible for all but $1,000 of the contract support for service. If an employee is applying to Sharp 3, which is ongoing and does not have an on or off cycle, the employer is financially responsible for paying 100% of the contract support for service over the 3-year commitment. As you can see, if an employee has not spoken with their employer and ensured that they have completed their 3-part application to the program, it can be quite difficult to be fully accepted into the program, even if basic eligibility has been established. This is why we require applicants to verify that they have or intend to have a conversation with their supervisory staff and/or their human resources department. This can be the difference between being accepted or having your application declined. The last topic I want to cover today is the importance of knowing the terms of your contract before entering into one. Sharp 1 is a 2-year commitment with a severe no-quit clause. Sharp 3 is a 3-year commitment with a less severe no-quit clause. Part of the reason why Sharp exists is to increase employee retention rates for employers. So it is a very serious contract requiring a strong commitment from practitioners who serve their communities. Alaska's Sharp program is for Alaska's healthcare workforce, with a goal to increase Alaskans' access to healthcare by enhancing the healthcare workforce. The incentives provided to practitioners and to employees who stay with their commitment for 2 to 3 years, and there are possibilities for an employee to apply to additional contracts. This is a great way to dramatically decrease and even pay off all of your student loan debt and perhaps earn quarterly direct incentive payments. Again, thank you for your interest in the Alaska Sharp program, and especially thank you for your service to Alaskan communities.